Today's video is a quick revision on acute renal failure. What is renal failure? Renal failure is described as a significant loss of renal function in both kidneys to the point where less than 10 to 20% of the normal glomerulofiltration rate remains. In renal failure, there is either glomerular or tubular dysfunction. The main function of glomeruli is filtration. So GFR will fall, leading to retention of toxic substances, including water in the blood and body. The main function of tubules is reabsorption. So any dysfunction will lead to increased voiding of dilute urine, which is called polyuria, with loss of electrolytes. For example, glomerulonephritis primarily causes glomerular damage, whereas aminoglycosides nephrotoxicity damages renal tubules. Renal failure may be acute or chronic. In this video, I will talk about acute kidney failure. Acute renal failure is described as a sudden loss of the ability of the kidneys to excrete wastes, concentrate urine, conserve electrolytes, and maintain fluid balance. There is a rapid loss of renal function, but fortunately the damage is reversible if promptly managed. This image shows damage to the renal tubules in acute renal disease. Due to injury, the brush border of the endothelial lining is lost and the polarity of these cells for ion transport is disturbed. Necrosis of cells occur due to ischemic or toxic injury, and apoptotic cells block the tubular lumen, further affecting the function of the tubules. Causes of acute kidney injury may be classified as pre-renal, renal, and post-renal. Pre-renal causes usually causes damage due to decreased blood flow to the kidneys. The causes include low blood pressure or hypovolemic shock, blood or fluid loss in cases of massive bleeding and severe diarrhea respectively, heart attack, heart failure, and other conditions leading to decreased heart function, organ failure, overuse of non-steroidal anti-inflammatory drugs, severe allergic reactions leading to anaphylaxis, burns, injury, and major surgery. Renal causes include direct damage to the kidneys. It may be a life-threatening infection called sepsis or a type of cancer called multiple myeloma, a rare condition that causes inflammation and scarring of blood vessels called vasculitis, interstitial nephritis due to allergic reactions to certain type of drugs, scleroderma which affects the connective tissue in different organs, inflammation or damage to the renal parenchyma, for example tubular necrosis, glomerulonephritis, vasculitis, or thrombotic microangiopathy. Post-renal causes are mostly due to blockage of the urinary tract. Blockage may be due to bladder, prostate, or cervical cancer, enlarged prostate, that is benign prostatic hyperplasia, problems with nervous system that affect the bladder and urination, kidney stones, blood clots in the urinary tract. Now, what are the clinical implications of acute renal injury? Signs and symptoms depend on the cause and may include too little urine leaving the body, swelling in legs, ankles, and around the eyes, fatigue or tiredness and nausea, shortness of breath, chest pain or pressure, confusion, seizures, or coma in severe cases. Diagnostic tests include measurement of urine output, urine tests, blood tests to find levels of creatinine, blood urea nitrogen, phosphorus, and potassium, glomerular filtration rate estimation for kidney function, imaging tests like ultrasound and computed tomography, and kidney biopsy. Treatment is mainly prevention of acute renal failure through support of blood pressure and blood volume, correction of fluid and electrolyte imbalances, dialysis to remove the toxic substances, low protein and high carbohydrate diet to minimize the formation of nitrogenous waste. This is only part 1. Make sure to check out part 2, which I will publish next Thursday. Thank you so much for listening.